Hi there, and welcome to today's webinar. It's good to see so many attendees. We are going to start the webinar now. So yeah, we're going to be discussing different measures that may need to be implemented on your return to the practice, and ensuring that you are back on track, and so your employees. So just to introduce myself, my name's Kelly. I'm one of Code iComply's HR advisors, and I'll let my colleague Sophie introduce herself.
Thank you, Kelly. Hi, everybody. My name's Sophie, and I'm a senior HR advisor in the Code iComply team. So what we are going to sort of look at today is I'm going to firstly talk you through our session content. So as you will all be aware, today's workshop will really focus on the steps that you need to take and also the risks to be aware of when you're considering your return to the practice. Therefore, the first topic we'll look at is those all-important unfurloughing arrangements. As and when the time comes for you, we'll give you some hints and some tips there. We're going to look at also the conversations that we really recommend you having and how you can document them during the return to the practice. The second topic we'll look at is how we can implement the temporary staffing measures and potentially more permanent staffing measures as well. So this will include sharing with you a brief redundancy process. We're then going to move on to an overview of managing the different types of absence when you return to the practice. So for example, sickness, self-isolation, because you may well still have team members who are isolating or need to isolate, as well as team members who may be on family-friendly leave, such as maternity or paternity. So we'll have a look at how we can manage those different types of absence. Up next, we will review some methods on how you can really manage and support your team with that reintroduction into the practice. So some tips there. And then finally, what we'll do towards the end of the session is really just make you aware of some risks and some regulations to be aware of. So more so your employer obligations there. And of course, if you do have any questions, we'll cover these towards the end of the workshop today. Now, we're really pleased to let you know that we have prepared a Get Your Practice Back on Track guide. Now, it's a HR focused guide that's available now for you to download in the handouts section of the workshop. And just to reassure you, really, we are going to cover a lot of topics today, but the majority of what we cover in today's workshop will be in more detail in that guide for you. So please don't panic if you miss anything or you forget to take any notes in a certain area. That guide will cover things in more detail for you. You'll also notice there is a COVID-19 return to work form in that download section as well. We'll mention this document throughout the workshop today, so please do refer to that one and download this because it will really support you with your return to work meetings at the practice. So Kelly's going to start today's workshop by talking to you about the return to the practice and looking at some of the unfurloughing arrangements.
So that is going to be a lot of questions that you're going to have is unfurling your team members. And at the moment, it is one of the main questions we've had on our helplines is how you'll be unfurling your employees. So the coronavirus job retention scheme is currently due to end on the 31st of October, with the cost sharing from the employer due to be introduced from the 1st of August. What we do recommend during this period of furlough is to continue having regular conversations with your employees about your plans to return to the practice and when this is likely to be. This way, there is no surprise to your employees when you decide to reopen the practice. Employers should also follow up any notice with written confirmation that they will be unfurloughed and the date in which this will take effect. When you've made that decision to unfurlough your employees, it is essential that you communicate this to your team with a reasonable amount of notice for their return. And as a team, we do suggest this is a minimum of 48 hours notice. Your team may have additional childcare or other responsibilities that they will need to make arrangements for, and your team members will also be entitled to return to their full pay rather than the 80%. So when processing your payroll post-furlough, remember that the national minimum wage and national living wage was increased on the 6th of April this year. Now, this will be a good time to address any of your team members that have been added back onto your payroll, and to take advantage of that scheme. So should they have left prior to the COVID-19 crisis, we do recommend getting HR advice on how best to manage this. So the conversations and documentation that you will need. So each of your team members would have had a different experience during this period, and it is really important to discuss with them how they are and whether there is any support as an employer that you can offer them. We recommend having individual conversations with your team members on their return to work, and you can explore different ways to support your team members. And we cover some options later on in the presentation. iComply members, you can use the COVID-19 return to work interview form. This will also be available in the handouts that you'll receive to format and document this conversation. By having these discussions, you will be helping to boost the morale and engagement within the team, and this will also help iron out any issues that could escalate to formal grievances, and is therefore a useful tool that could save you time and money down the line.
So we're now going to move on and have a look at some potential temporary measures that you may want to consider on the return to the workplace. Now, we know that it is a topic that's very popular on the helpline at the moment, with practices really wanting to know and to understand more really about what options are available to them in terms of staffing measures. Now, firstly, once we know more from the NHS, the government, potentially the Health and Safety Executive as well, we will need to consider that together with the expected reduction in patient appointments that we may face coming out of this pandemic. So you may well identify that it's actually not practical to accommodate the whole team back in one go, and perhaps a more phased approach may be a safer option for you. Now, a phased approach is going to be a temporary measure, and it could incorporate things such as layoff, short-time working, or even a continuation of that furlough scheme that we'll look at in the next slide. But before acting on any temporary measure, you will really need to identify the process that you have to follow. Now, if you have a layoff clause within your employees' contracts, you will not need to follow a full and formal consultation process with the team. However, we do very much recommend still talking to your team and taking on board any comments or concerns that they have during this time. Ultimately, this will really help to increase your engagement and could also prevent potential grievances further on. So it can be a really valuable and really important step to take there. If you don't have a layoff clause within the team members' contracts, you can still look at temporary measures and look at them as more as a proposal. You will need to follow the consultation process that Kelly will talk you through in a few slides' time. Now, the first measure that we're going to give you some information on is one that you may have already actually considered before the government announced the job retention scheme, and that is that of a temporary layoff. So I know we had lots of calls on the helpline before the government announced the scheme, whereby people were looking at contracts, seeing if they had that layoff clause and whether they could implement it. So it might well be something that you've already got a bit of information on. A period of layoff will only be implemented when there is a temporary reduction in work available to that team member. So it's very important here that it's a temporary measure. The layoff must be for a period of 1 full working day or more, and can often be used, and we would encourage it to be used as an alternative before you're looking at a permanent redundancy route. We have seen quite a lot of confusion recently, certainly with sort of the calls on the helpline, where there is confusion about the difference between a layoff and a redundancy. The main difference is that the layoff is very much a temporary measure where your employee will retain their employment status, whereas a redundancy is a permanent measure, and that ultimately, under the eyes of employment law, is a dismissal. So it's a dismissal on the grounds of a redundancy. Now, as I mentioned, a layoff must be for a period of 1 or more days, and there's actually no limit on how long an employee can be laid off for, or even put on short-time working, which we'll look at in a moment. However, it is important to be aware that your employees could apply for a redundancy and claim redundancy pay if that period of layoff has been 4 continuous weeks in a row, or it has been 6 weeks in a 13-week period. So those dates are really key when you're looking at potential layoffs for the team. So we can't ultimately stress enough how important it is to ensure that you're maintaining accurate records so that you can keep an eye on those timeframes. Employees who've been laid off are entitled to a statutory payment, and that's called a statutory guaranteed pay. Now, from the 6th of April, that payment was increased to £30 a day, and it's payable for up to 5 days in any 3-month period. We've also had quite a lot of calls on the helpline as who pays this, where does that money come from? It's actually the obligation of the employer, because it's a statutory payment. It will be coming from yourselves as the employers. Now, to be eligible for those payments, those statutory guarantee payments, the employee must have been continuously employed for 1 month or more. And as I just sort of briefly touch on, a layoff can last longer than those 5 days, but any additional time will be unpaid. Now, the second temporary measure that could be covered under the same layoff clause within your contracts is something called short-time working. Short-time working is a temporary reduction in your employee's contractual hours on a contractual day. Now, this one can sometimes get a little bit confusing. So here's a sort of a brief example for you. So you may have a team member who's contractually employed for 8 hours a day, 5 days per week, but actually taking into consideration, what we may know in a few months' time about the return, you may need to reduce their hours. So on their return, they are required to potentially work 6 hours per day, 5 days per week. But it's important to note, again, this is on a temporary basis. Now, this scenario, because that team member would have been reduced hours on each day, this is called short-time working. Now, as there's no workless day, so that employees working on each day that they're contractually obliged to do so, they wouldn't be entitled to the statutory guarantee payment, because that payment is only eligible if you're off of work for 1 or more days. The statutory, as I mentioned, that pay only kicks in when the employee is not required for 1 full day or more. Now, the third measure to sort of be aware of and to maybe consider is potentially the furlough extension. So we all, I expect, really want to know some more information on this, as it is slightly unknown as yet. The Chancellor, so I'm sure you're all aware, the Chancellor announced on Monday that the furlough scheme has been extended until the end of October. What we do know at the moment is that the current arrangement of 80% of pay capped at that 2,500 will continue until the end of July. After July, so in the last 3 months of the scheme, so you're thinking about August, September and October, the scheme will be adjusted to allow for some flexibility and to enable employers to hopefully bring their team back to work as those lockdown measures start to ease. We do believe that there could be some requirement for employers to share the burden of costs here, but obviously at the moment we don't know what that's going to look like. As and when we know more, we will of course update you and keep you well informed of any updates there.
So in addition to the temporary measures of pay reductions and changes to hours of work, you may want to make permanent changes. So we are speaking to many practices who are planning to consider decreasing hours of work, but it may also be necessary to increase practice opening hours due to having staggering patients or social distancing in line with the NHS and government guidelines. So this may include working evenings and or weekends, and you may have some team members who are multi-skilled and they can help with other roles within the practice. So the process for agreeing both temporary and permanent changes to contractual terms is quite similar. Now, I am going to go through quite a brief step-by-step guide and how you would be doing this. So stage 1 is to plan. So during the first stage, you will be planning and documenting what you are trying to achieve. For example, how the reduction or change in hours of work or shift pattern will work and what impact this will have on your employees. So stage 2 will be breaking the news. So once you have identified the plan, you will need to begin a consultation process with your employees. The initial meeting can be held as a group or individually if preferred. And during this meeting, you are making them aware of the proposed changes to their terms of conditions of employment. So stage 3 is the consultation. So the consultation stage could consist of several individual meetings with each employee, and this will also be an opportunity for the employee to raise any concerns and discuss any other options that they have thought about. It is good practice to allow your employees to be accompanied at consultation meetings by either a colleague or a trade union representative. We'd also advise that you have someone with you during the meetings to make accurate notes. Now, I know it's a bit of a difficult one during this time, as it's not necessarily ideal for you to be having those meetings, as we would usually recommend that they are face-to-face, but if you could be having those meetings over Zoom or any other means rather than it being sort of message, that we do definitely recommend that. You may also need to consider collective consultation if the change will affect 20 or more employees. So stage 4 is the agreement. So we recommend that you try to reach an agreement with your employees. So once this has been reached, the contract variation can be provided to your employees. And if you can't reach an agreement with your employees, we would suggest seeking expert advice on how best to handle this situation and explore those risks. So permanent measures, and we hope this isn't going to be the case for any of our members, although we are aware that some practices are looking at this, but redundancy. So redundancy is one of the 5 fair reasons for dismissal, but often is used in the wrong way or for the wrong purpose. For it to be a reason for dismissal, it must be handled fairly. So redundancy can be used when the business needs fewer employees due to lower services demand, such as there being less work, or not needing as many employees due to technology. So restructuring the practice, relocation, or closure are other reasons for redundancy. We do have a redundancy policy on iComply for our members, which will help you identify and support you through the process. And us as the advisors here at Code can also help guide you through this process. There are statutory guidelines that you will need to meet to make this decision within your practice, and this includes statutory redundancy pay, notice pay, and holiday pay. Now, Sophie's going to go through the redundancy process. You may want to listen to this as it's quite a lengthy one.
Thanks for that overview, Kelly. So yeah, as Kelly mentioned, I'm now going to take you through a very generalised redundancy process because ultimately it can really vary depending on the different circumstances. So if you are in this position, please do get some HR advice before proceeding. Now, as Kelly said, please stay with us during this process. There's 8 processes or 8 stages that I'm going to give you an overview, and I will just touch very lightly on them. But as we mentioned at the beginning, we do have the guide in the download section that will go through each stage in a little bit more detail for you. And of course, any questions, please do sort of give us a call on the helpline, or we may be able to help you at the end of today's workshop. So the first stage is really key, actually. It's really crucial, and that's where you're planning, you're documenting, and you're evidencing. So it's preparation. During this stage, you're going to be preparing things like your rationale. So what's led you to this decision? What have you potentially done to avoid this happening? And evidencing why you need to do it and that it's a last resort. The key point to keep in mind here, and something that we've seen employers sort of across all industries get wrong time and time again, is that you need to be identifying the roles at risk rather than the individuals. So by that, I mean you would be identifying that potentially your reception role or your dental nurse role or your practice manager role is at risk of redundancy rather than the individual people in those roles. So it's looking at your structure and really identifying what structure you need in place going forward. So you're identifying roles, not individuals. If you do have more than one employee in an identified at-risk role, you will need to follow a really fair and transparent selection criteria, which we'll look at in stage 4 for you. So moving on to stage 2. This is where you're going to be talking to your affected team members really about the proposal. So now you have your at-risk roles, you need to begin the consultation with them. The initial meeting can either be done as a group with everybody who is considered at risk, or individually if you prefer. Now, during this meeting, you're making your employees aware of the proposed reduction or proposed elimination of their role. And it's very, very important that we use the terminology of a proposal, as it's a consultation process you're going to follow, so no decision should be made straight away. It's also a legal requirement to consult, so it's important that you're able to document and evidence that you're taking the consultation process seriously. Now, you'll be following this meeting up with your proposal in writing, along with your reasons why, and invite them to an individual consultation meeting. Stage 3 is where you're starting to begin your consultation process. So as I touched on, during stage 2, you would have identified you would have advised those at risk that they are invited to those individual meetings. Your employees will have the legal right to be accompanied at each consultation by either a colleague or a trade union representative during the redundancy consultation. It's also really advisable that if you can, whoever is running that redundancy consultation is also accompanied by somebody there in an independent note-taking capacity. And that's just really going to free you up then to focus on the meeting rather than having to take notes as well. Because notes, sort of meeting notes and meeting minutes can be really, really important to review and refer to. When you are with less than 20 team members who will be affected by the process, there is no legal time frame on the amount of time you should be consulting for. However, what you will need to do is to evidence that that consultation has been meaningful. So to have those discussions, you're taking on board the comments or concerns, you're answering questions, and maybe seriously looking into alternatives that your team members may well propose to you. So it's important that you're keeping these really good records to show that you're following the process. This consultation could actually consist of several different meetings, and it may well be different for each employee. So it's not a one-size-fits-all approach. The individual meeting should be a really confidential environment. It shouldn't be rushed. So take your time with it, because it's really allowing your employees to ask questions and raise any concerns or comments they could have. And just again, it's important to remember there will often be more than one consultation meeting during this process, especially if you have to follow stage number 4, which is your selection process. So you only need to do this stage. So you only need to look at the selection if you have more than one employee in your at-risk role. So for example, you have identified your reception role as being at risk of redundancy. You've got 3 receptionists currently, and you might need to reduce it to 1. So by having that pool, almost, you've got a pool of 3 receptionists, you need to identify a fair and consistent way of selecting the chosen employees who will be made redundant. A way of completing this stage is by using what's termed as a selection criteria. It will include determining the criteria that you use to score your employees on, and this will ultimately help you to identify which team member or team members will be dismissed for reason of redundancy. You also will be required to share the scores with your employees, so please ensure that you're using a really fair, consistent and non-discriminatory criteria. Now, our total HR members, please do give us a call if you're in this situation, because we do have selection criteria, selection matrix that we can help and support you with. But a few examples for those, maybe without that HR support. So examples of criteria could be qualifications, could be their skills, could be knowledge, things like their performance. So you could look back at historic appraisal data, as well as timekeeping as well. So those are some really tangible things that you would be able to look at scoring team members on. Now, once the scoring has been completed, you will need to again meet with that team member individually, of course, to discuss their scores. So that's why it's very important that you're really transparent with it. Now, moving on to stage number 5, again, it's a legal requirement and one that quite often gets overlooked. So it's a stage where you can certainly trip up on. So before you confirm to an employee that they are confirmed as redundant, it's a procedural requirement that you need to consider any alternative roles or any current vacancies that they could potentially be suitable for. Now, a suitable role needs to be in terms of the same skill level and also the same sort of pay and conditions. So that's the criteria for it to be suitable. It's important here not to assume as well. So just because you may have a role that you think your team member may not be open to, it's really good just to have that discussion and to talk through during a consultation meeting with that team member that you've identified an alternative role for them. Now, stage 4 is where you're looking at your pay calculations. Now, Kelly is going to go through this with you in a bit more detail in a moment, how to calculate that redundancy pay. But just to make you aware, there is a really, really useful redundancy pay calculator on gov.uk, and that works out the statutory redundancy pay for you. You just need a couple of bits of information to hand, such as your employee's age, their length of service, and their weekly pay to be able to work that out. So just quickly then, your employees who have been continuously employed for a minimum period of 2 years or more will have the right to a statutory redundancy payment, and that redundancy payment is payable by the employer. You can provide extra redundancy pay or have a qualifying period of less than 2 years, and that would be part of what's called an enhanced redundancy package. But again, I'll let Kelly talk to you about that in more detail. But 2 other things just to really be aware of when you're doing your pay calculations, which again often get overlooked. Things like notice pay. So looking at their notice as part of their contract. Are they required to work it, or are you going to pay it in lieu of the notice? And also any accrued but unused annual leave, they would be entitled to payment for that in their final pay. Right, hopefully you're all still with me. We're on the last 2 stages now. So stage 7 is your final meetings, really, where you're issuing that notice. So during this final meeting, you would be talking to your selected employees and giving them notice of their redundancy. And again, I just mentioned it would be contractual notice as per their contract or statutory, so whichever is the greater. During this meeting, you will be reiterating the process that you followed. You could briefly recap on the meetings to date, potentially anything that's been questioned or queried. You can just be going over your response to that. And if your employee has nothing further to add during this meeting, you would then provide them with the verbal confirmation that they have been selected for redundancy and confirm the exit arrangements. So that's your redundancy pay, notice periods, etc. This meeting will need to be followed up in writing because you do need to give them written confirmation of that notice being issued. And it's also important to make you aware that your employee will have the right to appeal your decision. So please ensure that's documented in your letter as well. You'll also need to, during this final stage, is meet with those who are no longer at risk. So if you had more than one employee in an at-risk role and you're only sort of going to make 2 out of 3 redundant, that third person, you would need to meet with them to discuss that they are sort of no longer classified as at risk and that their job is safe. Stage 8, we're on the home straight now. This is where you will be supporting your team. So this is the final stage really, and one that can be quite difficult to face as a manager, and that's trying to motivate and boost the morale of the team following a redundancy process. So it's what in HR terms you call the survivors, so the people that are left from that process. Survivors will often feel quite anxious or quite stressed about what the future may hold for them. And if that is left unaddressed, it could really impact on their performance levels, their engagement levels, and it could also impact on sickness absence as well. So thinking about work-related stress or anxiety. Communication is going to be really key here to helping you. And by that, I mean, talking to them. If you can, share with them your plans for the practice and how they fit into this. So this will hopefully help to make them feel reassured and valued. You might also want to consider, just as a side note, some maybe team building exercises that can boost morale and get everybody back together and back on the right track for you. So thanks for staying with me there. Hopefully that wasn't too intense, but as I said, any more information that you need on that, it's in the guide for you. We've broken it down the same stages and we've just given you more information there.
So we're just going to touch on redundancy pay. This is quite brief, and what I would recommend doing is going onto the .gov website and looking at the redundancy and the statutory requirements you would need. So redundancy pay is calculated by age, so half a week's pay for each full year if you're under 22, 1 week's pay for each full year if you're between 22 and 41, and 1.5 weeks pay for each full year you are 41 and older. The length of service is capped at 20 years, and if anybody's been made redundant after the 6th of April this year, the weekly pay is capped at £538, and the maximum statutory redundancy pay you can get is £16,140. So if you're made redundant before those dates, those amounts will be lower. Be also mindful to check if contractual enhanced redundancy pay is applicable. However, please ensure any criteria for this is not discriminatory.
Lovely. So we're going to move on a bit now from sort of the measures, really, and we're going to look about really how we can manage things when we're back in the practice. And one of the key topics that we have on the helpline sort of before the pandemic and during the pandemic has always been about how we can manage absence. And I think really during these unpredictable times, it is quite important that you can demonstrate that you're really effectively and sensitively dealing with subjects such as sickness absence, potentially bereavement leave as well, and maternity and family-friendly leave. It's going to help prevent issues arising and mitigate your risk of grievances if you can really handle these in a sensitive and sort of really helpful manner. So the first type of absence we're going to just touch on is annual leave. Now, this is a really, really hot topic on the helpline at the moment, with practices wanting to know what their obligations are during furlough and also beyond furlough. So thinking about how we can fit that leave into the end of the year potentially. Now, the update from the government a couple of weeks ago did provide us with the much needed clarity that our employees are able to take leave, including bank holidays, during a period of furlough. It's also been established that any time taken as leave or bank holiday needs to be paid at 100%. So that's really important that we're addressing that pay gap between the 80 and the 100%. So if you missed your payroll for April perhaps, so maybe you had team members who were furloughed over the Easter bank holidays, it's just important to address that and make sure that if you are saying that they took bank holidays then, that you are addressing that 20% pay gap. Now, as I mentioned, we're also getting a lot of calls on the helpline from practices really concerned about how they're going to manage their employees' annual leave in what could potentially be quite a short period of time if your holiday year started in January. So to help businesses manage this, the government has actually relaxed the current rules around annual leave carryover. Now, it's been confirmed that due to COVID-19, the government has amended the regulations which allow statutory leave to be carried forward for the next 2 leave years. So you could, in effect, carry over up to 4 weeks of unused leave into the next 2 leave years. So that will really help to alleviate some of the pressure and some of the concerns that practices have in terms of how they can fit it in and manage it. Now, I know a lot of members as well are also looking at utilising different options here. Now, Another option that you have, and it's one that we would always suggest as a last resort because it can have a bit of a detrimental impact on engagement really, and that's that as employers you do have the option to tell your employees when to take their leave. The provision there is that you must give them the correct notice, and that is twice as many days notice as the amount of days that you require them to take. The pandemic is very likely, and I'm sure it's sort of impacted all of us, that in terms of pre-booked holiday, maybe foreign holidays, it could be holidays even in the UK that have had to been cancelled. So we do recommend that if this has had an impact on your team members, that you just discuss it with them individually and really talk about how you can perhaps accommodate it either later in the year or maybe even look at that carryover option. The next type of absence, this is one that we really wanted to make you aware of because it's something that gets quite often overlooked and some people aren't actually aware of it. So it's time off for dependents. So the Employee Rights Act back in 1996, it provides employees with reasonable unpaid time off to deal with an emergency that involves a dependent, and that applies to all employees independent of their length of service. So they don't have to have a qualifying length of service to be entitled to take this reasonable unpaid time off to deal with an emergency involving a dependent. I'm sure you will all be aware that during the COVID-19 pandemic, schools, nurseries, some care providers, respite centres, these have all been closed, and caring responsibilities have more than likely fallen to one of your employees if they had dependents sort of in those areas. Now, if this does continue into the period of time when you're looking at planning to reopen, it's really important that you're actually aware of this right to take the unpaid leave and your obligation as the employer. Now, just moving on to sickness absence. So we're thinking about both COVID-related and un-COVID-related sickness absence here. So it's still going to be pretty prevalent, I expect, in the next coming weeks, months, and possibly even years. So it's important that we have a really robust sickness absence procedure in place where we can record and monitor employee sickness absence and the reasons for the absence. But not only that, it's really important to have one as well so that your team members are aware of their obligations as well. So who do they need to contact? Do they need to contact somebody by a certain time to notify them that they're unwell? So iComply members will have access to a sickness absence policy, and that's available in your iComply folders. So the government, just to sort of stay with the sickness absence theme, the government announced quite early on into the COVID-19 pandemic that any absence related to the virus, so the statutory sick pay payment should be brought forward from day 1 rather than day 4. This isn't the case, for any other types of absence. So your headaches, your stomach bugs, etc. That's still the usual sickness absence procedures in terms of the pay, which kicks in at day 4. In addition, this may be one that you're not aware of. We did touch on it on our last workshop, but you may not have sort of picked up on it. And that's that small or medium-sized businesses who are eligible could potentially look at claiming the statutory sick pay rebate scheme. And that's for statutory sick pay paid out for COVID-19 related absence. And that's under the coronavirus statutory sick pay rebate scheme. Now, sickness absence during this pandemic may not always be COVID related. So it's important to keep on our radar, really, that our employees could potentially be quite stressed or anxious during this time. So we'd really recommend giving them as much support as you can. Kelly, in the next slide, is going to talk about mental health wellbeing and how we can support our team there. So please sort of use that time to pick up any tips. It may also be the case, though, that your team members could have had planned operations or planned courses of treatments. cancelled or postponed due to the pandemic. Therefore, their symptoms could have got quite severe by now, or could have be impacting them more than it had been. So that could potentially lead to some possible long-term sickness absence, which is why I'm saying having a sickness absence policy and procedure in place is really important, because long-term sickness should be covered in there as well for you. And just really, if you've got employees who are unwell, either now or in the next couple of weeks, just be considerate, supportive, and have a really sensitive approach to ensure that you're also complying with your duty of care, but actually reducing your risk going forward as well. Now, maternity leave and family-friendly leave, so that could include things like parental, paternity leave, and shared paternity leave as well. So public health guidance, I'm sure you're all aware by now, confirms that pregnant women are deemed quite high risk, and it has been suggested that they should be practicing social distancing, and definitely social distancing, and potentially self-isolation as well for up to 12 weeks. If your team member is in that situation, they will know, their midwife, their GP, their consultants will have let them know what procedures and what precautions they need to be taking. So it's really important that we talk to them, get that information, and understand how we can accommodate it and support it. We do really recommend speaking with the team members as often as you can, discussing and agreeing with them how we can manage this time. You could potentially also consider getting an occupational health service involved if you do need additional support in that area. Now, in addition to the physical risks, you will also have a duty of care to support their mental well-being too. So it's just important that you're carrying out those regular welfare calls, and that the employee feels fully supported in this area. Now, as I'm sure you're all aware, it's a requirement to undertake a risk assessment when your team member notifies you that they're pregnant. So even more so during this period of time, we need to make sure we're really hot on these, that we've got them done, we're evidencing them, and that we're reviewing them on a really regular basis as well. So you're covering off your duty of care there. And the final consideration is in relation to the Equality Act 2010. And that's that you're not treating pregnant employees either unfairly or at a detriment. So you can mitigate your risk here by ensuring that they remain part of the practice, so that they're included in any practice meetings. So that could be by Skype, for example. And also that they are invited and sort of encouraged to participate in the social events. For example, you might be doing virtual quizzes, virtual get-togethers. So they're all done by video call. So you're reducing the risk there because they're not going to come into contact. So it's important just to make them aware of it so that they feel part of that team and they don't feel that they've been left out or discriminated against. And having a policy and procedure in place, I'm sure you all hear us bang on about it all the time, but it's so important to have because it can really help you to manage the time that your team members are taking, and it gives you a really good document to refer back to. So it's important to have them in place if you can.
Thank you, Sophie. So as Sophie has mentioned, the mental health and well-being of your team members is really important, especially during this time. During the pandemic, your team members would have dealt with this in a completely different way to another, and may be feeling incredibly lonely, and it may be a really difficult time for them. You may also want to be mindful that their household may have taken a massive cut in income, and during this time may have been struggling financially, which can additionally put a strain on personal relationships. There has sadly been an increase in both domestic violence and relationship breakups during the COVID-19 pandemic. And if your team members have experienced either of these, their mental well-being could be affected. If you do identify that your employees are struggling, it is important to provide them support where you can. This could be by directing them to their GP or any external support organisations such as charities, or you can explore different ways as an employer of how you can help them. And during this time, unfortunately, some team members may have lost loved ones during the pandemic, which can be a difficult process even under normal circumstances. With the added impact of not being able to comfort family members or attend funerals, your team members may need your support more than ever and would likely need the flexibility from you to be able to come to terms with this. The first steps in being able to support a team member struggling with their mental health is just knowing the signs and what to look out for. Now, these can be physical, or you may notice a change in their mood. You as an employer will know your employees very well, and we just suggest being extra vigilant during this time should you notice any of these changes, and it's important not to ignore these signs either. Now, there are a whole host of support tools out there, and you can refer your team members to any of these. And there, like I said, there is more information in our handouts. The COVID-19 return to work form, which again is available in our handout. It's very good to sort of have that structure in place. The NHS Every Mind Matters, you can access that through the NHS website. There are a couple of mental health charities. There's Mind and Mental Health Foundation. Other ones that you can look out for is local occupational health providers and the EAP program, so the Employee Assistant Program, and also going back to GP referrals, so just referring them back to their GP should they, really be struggling with that. So we are anticipating a massive increase in flexible working requests due to caring or childcare responsibilities, and we do recommend that you prepare yourself for this. Now, all employees with at least 26 weeks continuous service have a right to request flexible working arrangements. Flexible working can take on several different forms, for example, working reduced or additional hours, working compressed hours, staggered hours, or working from home on a full or part-time basis. So employees wishing to make a flexible working request should do so in writing. iComply members can use the flexible working application policy as a support tool, and the employee will need to set out the changes, what date this will be, and how this will impact the practice and whether they have any solutions to this. All requests, including any appeals, should be considered within a 3-month period from first receipt. And if you are unable to accommodate the request, you will need to have a very good business reason why you can't accept the flexible working request. And as mentioned in previous slides, the handout does go into much more detail in how you can handle a flexible working request.
So the next couple of slides, we're going to be thinking about sort of supporting your team really and what we can do there. Talking sort of on that level really is thinking about things like grievances. Now, we do really hope this is not something that you will have to deal with during this time, because it will just probably add to your workload and add to stress levels. So it's something to try and nip in the bud as early as you can. So using support tools like the COVID-19 return to work form that we've provided for you, and reading through the guide and just understanding and knowing your obligations as the employer should really help you to prevent the grievances from escalating. Over the last few months, obviously, we do really appreciate, we spoke to lots of you about it, that you've had to make some quite difficult decisions regarding your team and how to balance those decisions with what's right for the business. So, for example, choosing which team members should be furloughed over which team members aren't furloughed, who should be carrying out essential work in the practice, who should be working from home, redeployment, the list is endless on those decisions you've had to be making. And to avoid the risk of your employees raising grievances, it's really important that those decisions have been made as fairly as you can. And I know, speaking to lots of our members, you have been doing all you can there. So it's just about documenting and evidencing your rationale for the decisions you've made. Most routine complaints in a practice environment can hopefully be dealt with relatively informally. So it's an informal discussion where you can sort of identify a resolution and move on from the matter. But where an informal resolution was not possible, the matter should be dealt with under a formal procedure. Now, to deal with a grievance, we really recommend having a grievance policy or a procedure in place. Now, our iComply members will have access to the grievance procedure in iComply, and to reassure you, that is very much based on the ACAS Code of Practice, which is what if it was ever escalated to a tribunal situation, it's what a panel would be looking to see you followed. So during a formal grievance process, you would be asking your team member to put their complaint, their grievance in writing for you to be able to really deal with that complaint. So you'd be sort of researching, looking into it and getting some information to back up the version of events. If the grievance is contested, so if they feel that you've not done enough, they do have the right, so your employees, do have the right to appeal the outcome. And this appeal would then mean that you would need to reinvestigate and have a second hearing to ultimately determine the outcome. Now, it's important that throughout this time of following a grievance procedure, your team member will have the right to be accompanied at those meetings by either a colleague or a trade union representative. And obviously, just touch on there already that they will have the right to appeal. So it's, grievance procedures can take quite a long time to deal with. There's a lot of work in the background that goes into sort of investigating a grievance. You might have to take statements from team members, maybe look back at historic data. So it can be quite a time-consuming process to follow. So it's really important that as and when you can, you're nipping things in the bud, and by using documents and identifying issues at the earliest opportunity. I can't sort of explain to you enough how much time, effort, and potentially money it's going to save you going forward. So it's quite an important sort of procedure to follow if you do have a formal grievance. But let's try and identify them and nip them in the bud if we can. So we're moving on now to looking at rights and regulations. So we just really wanted to make you aware of some things that you should be considering, some things to keep on your radar during this time period. And the first one to be aware of is the Health and Safety at Work Act, where employers have the legal duty to manage the health and safety risks, not only in the workplace, but also in the home working environment that I expect a lot of us are experiencing. The legal duty has only been heightened by the COVID-19 pandemic, so it's really, really important, sort of more now than ever, that you have really robust policies and procedures in place, and that you make your team members aware of them, ensure that they understand what they are obligated to do under those as well. Now, in addition to your current sort of risks and procedures, we would really recommend that you do a risk assessment to identify and consider any increased risks that COVID-19 presents to your team and also to your patients. So we do recommend carrying out a risk assessment to do that and identifying any potential measures you may need to put in place. Now, you could work with, in conjunction with your local area team or an occupational health provider if you're struggling with this step or you want to just check things. We would also really recommend that you carry out refresher inductions with your team. So this could be, just a refresher on your health and safety procedures, your infection prevention methods, and it's getting and asking the team members to sign and agree to the enhanced procedures as well. So it's getting that written confirmation that they understand and know their obligations of what they need to do to support you as well. During the refresher inductions, you would also be issuing them with any updated policies and procedures that you may have done as well. So it's just a really important step to take to ensure that everybody's on the same track when you return to the practice.
So we're just going to cover lightly on the Equality Act 2010. So throughout all of these important decisions you'll be making in the coming weeks and months, it is important to keep equality and fairness in mind. So this will also apply for unfurling your team members through to confirming redundancies and also considerations for how you manage and support pregnant or disabled team members. It's also essential for you to be aware of the obligations, regarding this Equality Act. So the Equality Act does protect certain groups of people from discrimination, whether as employees or service users of organisations and businesses in either the private or the public sector. So it does affect everyone's responsible for, running a business or service, including any employed staff. So the Equality Act did introduce the term protected characteristic for those groups protected from unlawful discrimination. And those 9 protected characteristics are disability, age, gender reassignment, so whether under medical supervision or not, marriage or civil partnership, pregnancy and maternity, race on the basis of colour, ethnic origin, nationality or citizenship, religion or belief, so this includes a lack of religion, faith or belief, sex and sexual orientation. So when you are making those decisions on your return to work and making those arrangements or restructures of the practice, we just highly recommend that you promote a diverse and equal workplace environment and take into account the protected characteristics and types of discrimination before finalising those measures.